Good morning everyone, myself Dr. Divya. On behalf of Neurology department, I am here in front of you all to enlighten you about the World Stroke Day. Every year 29th October is observed as a World Stroke Day. Why it is important to know about the World Stroke Day? It is because nearly 12.2 million people every year are getting affected by stroke, of which nearly 5 million people are left disabled by stroke. Nearly more than 80% of the strokes are preventable by taking a healthy lifestyle. So it is important for each one of us to be aware of stroke. What is stroke? Whenever a blood vessel supplying a brain gets blocked or ruptured, it results in stroke. There are two types of stroke mainly, that is ischemic stroke and hemorrhagic stroke. What happens in ischemic stroke is that whenever a blood vessel supplying a brain gets blocked by excessive cholesterol narrowing the lumen, it results in death of neurons. That is called ischemic stroke. What is hemorrhagic stroke? In this, a blood vessel supplying a brain gets ruptured due to various reasons like excessive blood pressure. It results in stroke. So, what are the causes for this stroke? Whenever there are altered blood sugars or increased blood pressure, elderly age group, or excessive intake of alcohol and smoking, excessive exposure to air pollution, and any altered health or eating habits like not eating on appropriate times or eating excessive fatty foods can result in stroke. And also sleeping habits, if they're altered, like if they're taking too much of stress, this can also result in stroke. So how do we identify this stroke? There is an acronym, that is B FAST, how we can identify the stroke. So B stands for balance. Whenever there is a loss of balance while a patient is walking, he may sway to one side or the other side. Or E stands for eyes. Whenever there is a sudden onset of double vision, that one object may appear as two for him. And in F stands for face, that is whenever a deviation of angle of mouth is present on the face, sudden onset, we have to suspect for stroke. A stands for arms. Whenever there is a weakness, sudden onset weakness of arms or limbs, also we have to suspect stroke. S stands for speech. Whenever there are speech disturbances like slurring of speech or decreased speech output, we should immediately suspect stroke. Last is T. T stands for time. Time is brain. We have to act as fast as possible and mobilize the patient to the hospital to prevent the morbidity resulting in stroke. Time is brain. Time lost is brain lost. So the cruciality or the importance of time is what we have to know. The theme of 2025 Stroke Day is every minute counts. So we have to act as soon as possible to prevent the morbidity resulting in stroke. Now once we mobilize the patient to the hospital, we have to get a CT or MRI done as soon as possible, and we have to diagnose the stroke, whether it is as ischemic stroke or hemorrhagic stroke. Based on the type of stroke, the treatment varies. So for an ischemic stroke, for example, if we mobilize the patient as soon as possible to the hospital, that is within 4.5 hours, it is called as a golden time for stroke. We can thrombolyze the patient. Otherwise, in a common terms, we say it as clot busters. We can lyse that clot by giving two different forms of injections, that is alteplase or tenecteplase. Or if it is a hemorrhagic stroke, still we can salvage the patient and decrease the morbidity resulting in stroke by doing decompressive craniotomy if the patient is in altered consciousness or if there is any excessive bleed in the brain. So by this you know the importance of going in appropriate time to the hospital. Prevention is better than cure. Rather than curing the disease, we have to do primary prevention, that is taking necessary measures to prevent the incidence of stroke, like maintaining a healthy lifestyle, decreasing or cutting down on sugars, maintaining a proper blood pressure and eating healthy food, and maintaining a proper sleep habits, that is sleeping on time, and cutting down on smoking and alcohol can help prevent stroke. Finally, I want to conclude by saying that beware of disability, be aware of stroke and prepare to prevent. Thank you.